Actually, I have a question now about Clostridium difficile. And that was a very interesting topic, because when I was a medical student, I used to read that, and that was very interesting, because at that time we were told that intrajejunally we have to inject feces from a resistant. Now, these tablets, is it like freely available? Because I'm sure that we could incorporate it into our practice as well.
That's a very important question, thank you. So, there's already even commercially available, FDA approved fecal microbiota transplantation in the United States. I'm not saying the name because I'm not promoting anything, but I just say the numbers. It's quite expensive. As I remember, when it was FDA approved in the United States, it cost $9,000 per dose per one person to treat Clostridium difficile. And basically, this is the fecal microbiota transplant, filtrated and screened. So, what about C. diff? That's a very dangerous problem. I believe you have it in Sri Lanka, and everybody has it. And patients unfortunately die sometimes because you have pseudomembranous colitis and toxic megacolon. Toxic megacolon is a surgical complication when you have to remove the colon or the patient dies. So in many cases, the only chance to live is to do the poop transplantation. So how to do it? The best way is the auto transplantation. It's like when a patient, for example, is expecting chemotherapy or an operation, you can take his feces, freeze them, and wait. If nothing happens, let go. But if he has a complication, you can defreeze his own feces and put them back. Yeah, and that's how you fight C. diff. Actually, it's the best way. It's not dangerous. But if you don't have them, then you have to find a donor. And it's interesting, not everyone is a good donor of feces. It really depends on your lifestyle. You have to eat a lot of vegetables, you have to be healthy. Just remember, I think it was a few years ago in the newspapers all over the world, that in France, in Paris, they offered like 50 euros, I think, for donation of feces, for poop donation. But you had to give it properly, so healthy. You don't have to be a smoker, drinker, So in ancient times, they used relatives. Like normally a wife gives donation for a husband, or opposite, vice versa. And today, if you find a donor, then you have to screen it properly. You screen it for rotaviruses, noroviruses, any other viruses. Of course, you screen it for salmonella, for cholera, etc., etc. So after this screening, how you do this? There are possible ways. What we do often, you take the capsule, the acid capsule, acid resistant, and you freeze it. Minus 53. And then it's just taken per oral. It doesn't smell. So when it goes down the gut, the colon, the capsule disappears and the bacteria go out. So it's possible. And you may do it in Sri Lanka, but you have to think with your Ministry of Health and with your guidelines. You should write a guideline because there are still risks there. If you don't screen it properly, you can get infected. So if you write a guideline with your specialist, with your microbiologist, you will use it. But personally, I believe that in future time, we will go to the next step. We'll go to microbial consortiums or microbial cocktails. When we select 3, 4, 5, 6, 7 good microbes from the FMT, from the transplant, and get them into the body. Because still there is a black box of transplantation. It means that we don't know everything about every microbe in this transplant. Microbes in the body are connected to diabetes, to obesity, to other diseases. So if you ask me, I don't know, in this transplant, maybe something will work its way in 10 years, and in 10 years, this patient will become obese. No one knows.
And so we have a few questions from the media that they handed over. So one is, what's our opinion on how we are going to move forward? So I think that question is for our team.
We know that Gomel University is a reputed university and doing a lot of research, and as the Chancellor presented, leader in so many other aspects in medicine and healthcare. As a leading university in Sri Lanka, we also have our strengths. So we can combine our strengths and this will move forward. And as some of our academics also are working on these gut microbes, research is going on. So some professors, so we will collaborate and we can proceed. Then apart from that, as two universities, we can have staff and student level exchanges.
Okay, thank you. So any questions from our students? Now these microbiomes, isn't it? So I have some more. Yes. I'll ask the media's question in the meantime so that we don't waste time, isn't it? So that's good.
Good afternoon, sir. I'm MG Nonadu, a military medical student from Intech 40. So you said, sir, in the microbiomes, in the harmful bacteria of the humans, they can change, right? They have capacity to change. They are a step forwarding for us. But so as the answer, we are going to use the microbiome. So my question is that the ability to change the thing, the capacity of changing the same thing can be happen for the microbiome also. So if microbiome will change to the worst, it will affect again for the humans. So is there any studies or anything for that, sir?
Thank you for your great question. Actually, there are a lot of studies on so-called disappearing microbiome. It's very interesting that there are principally two types of diet: the Western diet and the traditional diet. So the Western diet, it's something that's happening right now in Western world in large cities. So they eat a lot of unsaturated fat. They eat a lot of burgers, fast food, soft drinks, soda water, Coca-Cola, Pepsi-Cola, etc., etc. And they eat very low amount of vegetables. So normally in traditional cuisine, I'm not sure about Sri Lanka, but I believe so, you were not eating meat every day in ancient times. So mostly vegetables, sometimes fish, but meat was not for everyday use. And so in traditional microbiomes, they were very diverse. So today, many people, even here, eat a lot of fast food, eat a lot of pre-cooked products, like products with meat that is pre-cooked, sausages, etc., etc. So actually, this changed microbiome a lot, in a bad way. So even now, some scientists are looking into some, jungles to look for Aboriginal people who have their intact microbiome that is not affected by modern diet. So even in this country, I believe, it's hard to find people who are not eating chips, fast food, etc., etc. So we are losing a lot. So right now there are banks of microbiome in the world where they try to freeze these bacteria from the traditional microbiomes. It's like genetical freezing. If something happens, we could defreeze it, this good bacteria, and use it. Just imagine one of the parallels. There are different crops in Sri Lanka, in Belarus. They're so-called banks of seeds. If something happens, for example, a fire, or a catastrophe, and we need to restore our crops, where do we find the seeds? We have to maintain the seeds in the banks. The same with bacteria. In future years and centuries, if we proceed with fast food, with unsaturated fat, we will lose a lot of good microbes. So your question is very right. We have to think about it, and we have to think about it today. So think about your diet, think about your lifestyle. Try to eat more vegetables. Try to eat more local food. It's better to eat local. Normally there is a theory called locavorism. It means you have to eat something that is grown within 400 kilometers from the place you live. So eat local.
So I know we are short of time as well, but there's one more question from media that I think I should ask you. How can you help us develop war medicine in Sri Lanka? This goes to our professor.
Concerning our collaboration, that's a more broad question I would like to tell. So Our university, as I already mentioned, has a military medicine department, and we offer the possibility to study military surgery, military therapeutics, military epidemiology, and our graduates, they are awarded, granted the rank of a lieutenant of a medical service. So at the 6th year of study by the Minister of Defense, like you here, they will become a lieutenant, and then they will grow up maybe to a general someday if they be the best. So we can offer to study nuclear medicine. I think this is important because our university has strong scientific research. Our university is located quite close to the Chernobyl nuclear plant. So all of you know the Chernobyl nuclear disaster that happened in 1986. So it happened quite a long ago, but still has a lot of consequences. And we have great experience in studying and researching the effects of radiation and the consequences of nuclear effects from nuclear stations. So your country, it's situated near large countries who have nuclear weapons. Your neighbor India, it has nuclear weapons. Pakistan, they have nuclear weapons. So I believe that we should study the nuclear medicine and the radiation effects and the ways how to protect civil and how to protect soldiers and officers from the nuclear weapons. So we can offer you the ways for academic exchange and for research in this area.
Okay, since we are short of time, I will limit the questions from the media. And they have recorded our discussion as well and the presentation, so they'll be taking a clip from that. Thank you so much.
Thank you very much, ladies and gentlemen. I believe now officially we have concluded today's proceedings. Thank you, gentlemen at the head table as well, for attending and for speaking at this media discussion as well. Thank you, ladies and gentlemen, of this prestigious caliber for coming, for attending at this very, very important event. Thank you very much. Have a pleasant afternoon.